Cardiology or internal medicine, which specialty one should pick? And yes, cardiology is a separate specialty of 5 years in Turkey, unlike many other countries where it's considered a subspecialty after you have done your internal medicine residency. I've just passed my Turkish medical residency exam with flying colors, and now I have the opportunity to be able to get into any residency I want, from the ones that are considered highly competitive abroad, like neurosurgery or cardiothoracic surgery, to the ones that are highly demanding in Turkey, like dermatology, radiology, and maybe plastic surgery in some of the hospitals here in Turkey. Back in medical school, I used to think that choosing a specialty is very easy. You just have to pick the specialty that you like. But as I've been through my internship year and I've been working for 4 years in emergency medicine, I've realized that it's not a straightforward decision. Because this is the decision that is going to shape your life, your career. So there are a few things that you need to consider before you pick a specialty. And these things are the pay that you're going to get, the work life balance, um, what you expect from life, risks, complications, malpractice. All of these are factors that should come into play before you make a decision of choosing a specialty. Back in the internship year, I realized that surgical fields are not for me because of the workload and the work life balance. So now I'm just left with medical specialties to choose from. And these are pediatrics, internal medicine, cardiology, as I've just said, is a separate specialty here, and emergency medicine, also psychiatry. So for me personally, I do not have much interest for psychiatry and pediatrics, leaving me with emergency medicine, internal medicine, or cardiology. For me, I feel like I like cardiology a little bit more than internal medicine or emergency medicine. But before I make this decision, I also thought about some other factors that I've just mentioned, considering the risks, the complications, the mortality rates that the cardiology field has, also the work-life balance. So when you compare this with internal medicine, your hours are more flexible, the mortality rate's a little bit low, the procedural work is a bit less, so of course the complications and the risk of malpractice is also a little bit low compared to cardiology. So these are the factors that made me think about internal medicine a little bit more compared to cardiology. And at the same time, I do like the idea of having knowledge about almost every disease out there, as much as possible, of course. So therefore, right now I'm leaning towards internal medicine. So guys, let me know which specialty should I pick, and if it's the right way of thinking before picking a certain specialty. Let me know in the comments down below, and also what you would have done if you were in my position. Thank you.